All right, guys, welcome back to Black with Vascular. Another day, we're talking about peripheral arterial disease and risk factors, as well as just a general primer for many patients. I'm doing this because I was reading a wonderful article by Caitlin Hicks about claudication, and I've had so many patients who have had pain in their legs. Claudication is pain in your legs when you walk, which typically goes away when you rest. And so many patients have this problem and they come to me wanting a procedure. And I've told so many patients for so many years, try to stay away from procedures as much as possible. Wait, and if it's really bad, then you can always blame me later, but you can always go back and have a procedure at that point. But the reality is that I strongly believe, and have always believed since I started this journey within being taught by some of the senior people about vascular disease and claudication and peripheral arterial disease, that we should not be operating on people unless they have a wound that's not healing, or severe pain that's so bad that they can barely walk, or it's so bad that it's getting out of hand. If the only other time is when you have a patient who understands fully understands the risk that they might end up with an amputation if you operate on them, or if you do a stent or some minimal invasive procedure. And once that patient fully truly understands that risk and decides that I do not care about losing my leg as much as I care about living a life without pain, now that patient is somebody who might be able to be qualified properly for a bypass or a stent or some minimal invasive procedure, these atherectomy and all these other. And for anybody who's listening who's just a patient, any procedure meant to improve blood flow carries the same general risk. If the new teaching is, and what we're finding out and what we're proving in studies, is that if you have claudication, this is stuff that we knew from in the 80s and maybe even older, but the new studies from 2025, and there is the article by Caitlin Hicks that came out, it shows that peripheral arterial disease ideally should be treated by just quitting smoking, walking, eating vegetables and living a healthy diet, taking anti-cholesterol agents, taking your aspirin, taking your statins, and in general just doing the same things that you would do to live a healthy life, controlling your diabetes, controlling your blood pressure, lowering your stress levels. These are the things that will do you the best in the long term, but it is a long and difficult road. And so I do get it if people do eventually say, you know what, I want to have a stent or a bypass surgery. I can understand why doctors do treat also. With that said, you should know what you're signing up for. So again, this is a video from Black with Vascular. I hope it was helpful. The idea is claudication and pain with walking is best treated by walking some more. Good luck, and I'll see you in the next video.